Dr. Michael Nusbaum.
And I'm Dr. Daria Klachko Totten.
And welcome to HealthTalks. Today I'd like to talk about plateauing on injectable medications.
Okay, great topic.
Yeah, we have a lot of patients who are on semaglutide and tirzepatide, Wegovy, Mounjaro, and a lot of patients tend to hit plateaus and are not sure what to do, and a lot of times their practitioners don't know what to do, or they're not even seeing a practitioner, a doctor, which is a problem.
Not a good thing.
No. But we see that a lot. So, what are some of the things you can do to fix a plateau? So the first one is, you're injecting into subcutaneous tissue.
Right.
And we have found that patients who continue to inject in the same location sometimes hit plateaus.
Ooh, that is so interesting.
Yeah, and I don't know if it's because that area, the adipose tissue, becomes resistant to absorbing the medication, but we found if you actually change locations, sometimes the medication gets absorbed better.
Oh my God, that's something that I really never even thought about.
Yeah. So, if you're injecting the same place in your belly, switch to the other side. If you've already switched back and forth, maybe try your thigh or your back of your arm. But you consider changing the location.
And that makes sense too, because sometimes you get bruising from injections and sometimes they get sore.
And maybe that's part of it. Maybe the bruising can stop it from getting absorbed. It's not really clear, but obviously changing location is very important. Second thing is a lot of patients fall back into their old habits.
Yes. Oh, yes.
And this is where, registered dietitian is extremely important when you're on these medications. Just getting it online or from a doctor who's just saying, here's your prescription, go ahead, good luck in your weight loss. Really not a great recipe for success. So a registered dietitian is going to help you kind of track your habits,
right.
I recommend doing a food log so you can actually go back with your practitioner and see what you were doing that was probably wrong, falling back into those old habits. But you may need to, have a diet plan that fits your body rather than just go right back to what you were doing before and think.
And your lifestyle probably too.
Yeah, absolutely.
That can fit your lifestyle. I think that's so important with any kind of diet that you go on, right? If you don't change your old habits, you're just going to gain the weight back.
Correct. And I think that's one of the biggest problems with these injectables is patients are not changing their habits and then they gain the weight back. They're like, well, wait a second, the medication didn't work.
So it's more of like not the medication, coming off the medication per se, causing the increased weight gain. It's more like you're going back to your old habits.
Exactly. Right. And I think a lot of patients don't understand that the medication is great for losing weight, but what's your long-term plan? Right? Not just the short-term goals. What's your long-term plan?
It's like use the medication to help you get that weight off fast.
Correct.
But then you have to have the plan afterwards to change your lifestyle and change the way that you're eating.
That's where you need a program to help you with that.
Yes.
So the next thing is you may need to increase the dose. There is some evidence to suggest that over time you develop some resistance to the medication. So you might have to bump the dose up a little bit. I wouldn't recommend bumping it up too quickly because then you're going to get side effects. But increasing the dose.
Don't increase it yourself. Always talk to the doctor about how you increase the medicine.
And there's the problem too. A lot of patients are getting it online. Who you're really going to talk to? So you want to increase slowly if you're going to increase it. But yes, if you have a practitioner, you should definitely be asking them. If you don't, you need to get one. The next thing is water intake. Water intake is really important during any diet, and you see a lot of these medications that are causing constipation. They're not causing constipation. What happens is when you burn fat, it's very expensive water-wise, meaning your body needs to burn a lot of water in order to burn the fat. Remember, oil and water don't mix. Fat is anhydrous. So in order to actually burn that fat, your body needs water. And it really comes down to the Krebs cycle and converting ADP to ATP in order to convert those lipids to ketones. But without getting into the nitty gritty of how it works, you need to be drinking a lot of water when you're on a diet. So if you're dehydrated, certainly if you're getting constipated, it means it's your fault. It's not the medication's fault. You're not getting enough water in. You're not going to lose the weight. And the whole system is going to shut down. The lipids that were just released from the adipose cells are going to go right back to fat. You're not going to burn the fat, and you're not going to really lose the weight. So you got to bump the water up.
How much water?
Good question.
Do you have a guide or?
Yeah, I would say minimum are 68 ounces, but a gallon of water, not uncommon in a lot of patients to need a gallon of water. a day in order to actually burn the kind of fat they're burning. And it all depends on what kind of weight loss you're having.
Right.
And then the last thing is, once again, you really need to be under supervision of a registered dietitian.
Yeah.
I mean, that's really important. So anyway, if you're on a semaglutide or tirzepatide, you're on one of the injectables and you're hitting a plateau, I certainly think you need to take into account those 5 things. Change your injection site, track and stop old habits, increase the dose, increase your water intake, and find a program with a registered dietitian.
I think that's great advice.
Thank you. All right, as always, if you're having any issues with your weight loss journey or have any questions, let us know. I'm Dr. Michael Nusbaum.
Dr. Daria, Klachko, Totten.
And thank you for joining at
HealthTalks. Bye.
Bye.